वेलकम टू दिस चैनल। मैं डॉक्टर टी देवनाथ, डॉक्टर ऑफ मॉडर्न मेडिकल साइंस, मोटिवेशनल स्पीकर एंड लाइफ कोच। आज इस वीडियो में हम बात करेंगे, अगर आप नर्सेस हैं तो अगर आपका क्या ड्यूटी होगा इन अल्कोहल विथड्रॉल ट्रीटमेंट पेशेंट। ओके, so any patient admitted from the OPD or emergency, doctors will write the prescription and they will give the patient. The patient will go to the nursing station. Now duty started from there. Nursing station, patient will go there, nursing station, and you need to assess the patient for the allotment of the bed, which bed you will provide for this particular patient. Now you will allot a bed for the patient. Number one, preferably the bed should have propped up positions. Okay, propped up positions, because if patient is in alcohol withdrawal and patient go into delirium, there is a chances of aspiration. That means whatever food he or she has taken, it can be regurgitated to the respiratory tract, where patient may develop these cracks and everything, and patient may collapse also. So preferably if there is bed available which can be propped up, that bed should be allotted for this patient. Number one. Number two important point, you have to remember, we will check for the SpO2, means oxygen saturation. Sometimes patient needs some extra oxygen support, so preferably that bed should have oxygen connection also. So we will allow bed which can be propped up. Okay, propped up position we can do it. Number one. Number two, which bed has oxygen supply. Okay, if these facilities are available, you should allot that bed for this particular patient. Those are in alcohol withdrawal state, either in mild or moderate form, or whether patient is going to delirium tremens, which is a severe form of this alcohol withdrawal. Okay, so any kind of patient we try to preferably give the bed which I have already told. Number one. Number two, once patient is in the bed, now you have to put IV cannula. You have to put IV cannula, right? IV cannula, remember, IV cannula should not put on the joint. Any over the joint, never. You are getting very good vein over the joint, but don't give over the joint, because क्या होगा, over the joint होगा, joint मतलब there will be some movement. Okay, so if you give in the joint, so there may be chances of swelling and all, and it will be discomfort for the patient also. So preferably you don't give over the any joint. Okay, so this is the important part for the cannula. And another thing which our doctors repeatedly ask for, that is, whenever you give the cannula, right, you give cannula, okay, then you connect the IV fluid. So once you connect the IV fluid, that IV fluid, this tube should have been supported in along with this cannula. That is very important part. Sometimes we see that you have just given cannula and IV fluid jo set hai, it just connected like that only. So anytime it may get disconnected, there may be huge bleeding and patient may collapse also. So that part should be remembered, that if you give the cannula there and if you connected the IV line, that IV line should be supported with the extra adhesive. Okay, so that the accidental damages does not happen. So that part you should remember. Then you will give IV fluid whichever has been prescribed by the doctor. Now once you are giving IV fluid, definitely you need to monitor the output. You need to monitor the output, how much fluid you have given and how much urine output is there. You need to calculate. So we need to catheterize the patient. Once if patient is not able to go to the bathroom for the urine and stool, you need to catheterize the patient. And if you catheterize the patient, one benefit is that you can measure the output, but one side effect of this cannulization is that catheterization is that UTI, that is infection of the urinary tract. So it has advantage as well as it has side effect also, but still you will decide whether catheterization will have benefit or will have some more side effect. According to this side effect and advantage benefits, we call it as risk benefit ratio. We will catheterize the patient. Okay, Now, important point you need to remember that definitely you should monitor the vitals also. In vitals, you need to record the blood pressure, you need to record the pulse rate, you need to record the respiratory rate, as well as you need to record the temperature. These are the important vitals of the patient. Actually, if vitals are stable, remember your patient won't die immediately. If vitals are not stable, then you are in trouble. Okay, anytime patient may collapse. So you need to be very careful in the vitals monitoring. And number 7, I always scare about this aspiration. Okay, aspiration, because patient is already drowsy or in a disoriented state. He is not knowing actually where he is. He is totally disoriented to time, place and person when patient is in the delirium. So in that case definitely aspiration, if you are taking if you are giving food, especially fluid, any kind of drink, fruit juice and all, patient parties are really, they are very worried about their nutritional status in the hospital, and they never bother in the house, but when they are in the hospital, they want to feed anything they want, from starting from the fruit juice to anything, chicken, mutton, everything they want to give it. I don't know why, but anyway, if you are giving the drink or any kind of food items, and if patient is taking all these things in the lying down position, there is a very high chance that food will not go into the stomach, rather it will go into the respiratory tract, and patient will have breathing difficulty, patient will have cramps and all, everything in the chest, if you auscultate the chest, and patient may collapse in the ward itself. So definitely, once patient is in delirium, try to avoid giving food or any kind of drink. If you want to give, that position should be mentioned or trained for this attendant, that anything you want to give, you should be given at sitting position only. Okay, so these are the important part if you are a nursing student, and you need to consider all these things. And definitely sometimes we see the cannula site get infected, okay, or it there will be pain, there will be temperature, there will be swelling. So you need to take care of all this part. Okay, you need to take care of all this part. If you are giving proper care of this patient, there is a chance that patient will recover. Remember, delirium tremens is a condition where we may lose the patient, even it is 5 to 15%, almost 5 to 15%. Means if we are admitted 100 patient, there is a chance that 5 to 15% may die in your ward if you are not treating it very properly. So your responsibility is very high. And another important thing I want to mention, that all about the drugs. Whatever the drugs, please give how the doctor has prescribed. If there is any discrepancies, or you think something is wrong or something is missed, you definitely consult with this doctor, and you should give properly. Number 1, you need to give injection, whatever given, whether it is in IV position or in the IM route. Which route has been advised, you need to follow. Number 1, in IV, remember, whenever we give injection lopez, remember, don't be hurry, because we always write slow IV. Slow IV means slow IV, because if you give very fast IV lorazepam, there is a chance of side effect, and we may lose the patient, because it may cause oversedation. Number 1, it may cause respiratory depression. It may cause respiratory depression, and the patient may die. So definitely, whenever you are giving the injection lopez, always look about the slow word. If it is not written, still you need to give slow. Okay, if it is mentioned in the IM form, definitely you should give in the IM route only. This is the important. But I want to mention about this, especially these injections. These are very important. You can't miss, or you can't do anything wrong in this particular setting, because the patient outcome definitely depends on you. Doctors, definitely he is very, very responsible. But remember, your work is much more responsible for patient's outcome, whether patient will improve or patient will deteriorate. I think if you know all these things, you can manage a patient with alcohol withdrawal syndrome in any stage, whether it is in mild withdrawal, moderate withdrawal, or in the delirium tremens. You can be very well manage the patient if you are knowing all these things. Thank you so much.